Hey everyone, welcome back to Social Security Solutions. Today, we're diving deep into a critical issue that's been making waves in Congress, the proposed cuts to Medicaid. We're talking about hundreds of billions of dollars, a whopping 13% of the budget potentially being slashed. And let's be real, anytime the government makes such sweeping changes, there are always unintended consequences. So let's break it down and see who's really going to be hurt by this. First off, let's address the elephant in the room. We've all heard the arguments about fraud, waste, and abuse. It's become this catch-all phrase that seems to justify any cut. But let's look at the facts. I've been in the trenches, working with the Department of Social Services, handling Medicaid, food stamps, and more. I've seen firsthand how the system works. To get benefits like Medicaid, you need to prove your U.S. citizenship or have a valid green card. The system is already in place to weed out those who aren't eligible. So the idea that undocumented individuals are flooding the system and taking away benefits is just not backed by the law or reality. Now, let's talk about the real people who rely on Medicaid. We're talking about the elderly in nursing homes, disabled individuals, and working folks who just can't afford health insurance through their jobs. These aren't lazy people. Many of them are working multiple jobs just to make ends meet. And yet, the proposed cuts are going to hit them the hardest. Imagine losing your prescription coverage, your access to doctors, and being forced to rely on emergency rooms, which, by the way, is far more expensive in the long run. And let's not forget about the hospitals. Rural hospitals are already on thin ice. They're barely keeping their doors open. These cuts could be the final straw, forcing them to close down. That means longer travel times for emergencies and fewer healthcare options for communities. But here's the kicker. The proposed changes include doubling the reviews for eligibility, more red tape, more bureaucracy, and fewer staff to handle it. This means that even those who truly need and are eligible for Medicaid might get caught in the crossfire and lose their benefits. We've seen this happen before, with millions losing coverage due to bureaucratic mess-ups. It's not just about cutting costs. It's about ensuring that those who need help the most don't fall through the cracks. So, what can we do? If you agree that there must be a better way to address fraud without punishing the most vulnerable, make your voice heard. Call your representatives, share your stories, and let's work together to find solutions that make sense for everyone. Stay tuned for more insights and updates on this critical issue. And remember, taking care of our most vulnerable citizens is a reflection of who we are as a society. Let's make sure we're on the right side of history. We also need to talk about how these Medicaid cuts affect children. Nearly 40% of all children in the U.S. are covered by Medicaid or CHIP, the Children's Health Insurance Program. That includes routine checkups, immunizations, and care for chronic conditions like asthma or diabetes. Take that away, and we're talking about setting back an entire generation's health and well-being. These are the foundational years. If we strip resources now, the consequences will echo for decades. And don't forget mental health. We've come a long way in reducing the stigma around mental health care, and Medicaid has played a huge role in that progress. It funds behavioral health services, substance abuse treatment, and community-based care programs. If the proposed cuts go through, we're not just talking about inconvenience. We're talking about crisis. More untreated mental illness, more addiction issues, more people ending up in jail or on the streets because the help they need simply won't be there. Let's talk numbers for a second. According to recent data, over 85 million Americans rely on Medicaid. That's 1 in 4 people. When you make cuts on that scale, 13% of the total budget, you're not trimming fat. You're cutting into muscle. Real families, real lives, real consequences. And there's a larger economic impact here too. Medicaid doesn't just help people, it supports jobs. Think about the people who work in nursing homes, clinics, hospitals, and home health services. These workers, many of whom are low-paid themselves, rely on Medicaid funding to keep their jobs. Slash that funding, and you're looking at layoffs, overburdened healthcare workers, and reduced quality of care for everyone. Now, some lawmakers argue that states can just fill the gap or find innovative solutions to deal with the funding shortfall. But let's be honest, many states are already struggling to balance their budgets. Forcing them to pick up the slack is like throwing someone a boulder instead of a life raft. It doesn't solve the problem, it just shifts the burden from federal to local levels, and ultimately to the people who are least able to bear it. This issue also hits communities of color particularly hard. Due to long-standing disparities in income, employment, and access to healthcare, Black and Latino communities are disproportionately represented among Medicaid recipients. Cuts to Medicaid, therefore, risk deepening those inequalities and reversing years of progress in addressing systemic healthcare disparities. Let's also